Alan, thanks for joining me.
You bet.
Let's talk about chronic care management as an overview. Can you educate us? What is this?
Sure. Chronic care management, or comprehensive chronic care management, as we like to refer to it, is taking care of seniors primarily in dealing with their chronic conditions. In addition to helping them develop goals and attain those goals to create a healthier lifestyle, chronic care management encompasses even much more. It encompasses helping seniors deal and access all of their social determinants.
What is a social determinant?
Social determinant is really defined as access to education, to all aspects of medical care, food, transportation, etc.
Speaking from my own little experience, I have an elderly mother. I know that it is quite difficult for her in order to, let's say, make appointments, get them in a routine fashion, make them in such a way where they can be in the not too distant future, medications. I know she has those issues. So
Yeah.
can you explain to me is there like an overarching issue or issues that seniors are facing that your particular service helps with? Like, explain what are the issues that many are facing that your service resolves or helps them to resolve?
I would say there's two areas, broadly speaking. The first is how do I create a healthier lifestyle to deal with my hypertension or diabetes? Number one. These can be setting up goals such as exercise goals. Maybe it's not letting the dog out of the sliding glass door to go to the bathroom every day, but rather putting him on a leash and taking him for a walk myself.
Okay.
Right? So we help encourage people to get active from an exercise standpoint, and create a healthy diet is a big thing too. Our diets are filled with so many salts and unhealthy foods. And so correcting diet needs, limiting sugars, et cetera, for those who need those sort of that sort of help is part of it. The other part is dealing with the social determinants that we spoke about. It's the biggest challenge I would say that seniors have is setting that appointment. So whether they're dealing with challenges such as depression, for example, and they just can't get on the phone to make those phone calls, to call that referral that their primary care physician asked them to call, or it's just the challenges of actually getting through to a clinic.
Sure.
Or to a pharmacy, or dealing with transportation. Many seniors have difficulty with transportation and can't get to the doctor, or to medical care, or to even get to the grocery store. So helping those seniors access what they have available to them is what we're all about.
Understood. And I'm assuming here that, let's say, some of the goal setting that we talked about, or the nutrition, is it a fair statement to say that they're going to their primary care doctor, they have limited time with that individual, I assume, and there isn't much follow-up currently in place, hence the need for your service and hence the benefit of the service? Is that a fair statement?
Yeah, it's a fair statement. Maybe to take it a little further, we act as a care management department for a medical practice. As you said, a medical practice is really focused, and their core competency, of course, is dealing with the clinical office visit, right? What we do is think of it as customer service,
Okay.
right? We call it client care, right? So we're the care management department who the patient has access to 24/7 to receive and access care. So let's say, for example, they just need to set up an appointment to come in to see the doc. And they call the doctor's office and they can't get through on the phone lines, which is a big challenge.
Yeah.
Ask most physicians, and that's one of their largest challenges, is to effectively deal with that phone traffic. Well, working with WeCare allows that patient to contact us directly as the care management department to facilitate that interaction with the clinic, to set that appointment, to make phone calls with them, to call the referred doctor, for example.
Hmm.
If they're dealing with challenges, pharmacies, et cetera, we make those phone calls with them to help work through those challenges, which can be very frustrating.
Sounds like a concierge service to me.
That's how we refer to it, exactly.
VIP concierge service.
And we teach and we treat all of our patients as our clients, as our VIPs, if you will.
Someone listening to this might say, well, who's going to pay for this? Is the senior going to pay out of pocket for this service?
That's a good question. So CMS or Medicare pays for chronic care management services as any other Part B medical expense. A patient may have copays that are associated with those Part B expenses. However, the lion's share of the payment is paid for under the benefits that a patient has access to through Medicare.
Understood. And again, forgive me, I'm a layman here, but from what I'm understanding is that there's a limited, if not any, payment required from the senior. It's almost as if it's an unused benefit if they're not hiring you.
Absolutely.
Fair statement?
Yeah, patient benefit as well as a benefit to the practice.
Elaborate, if you would.
Well, so obviously we've discussed how we benefit that patient through our interaction and our concierge service, our hand-holding through the medical world. We also help the practice in many different ways. We help the practice through that service by lightening up their phone traffic coming through so that their staff can focus on their core areas of concern, which is helping that patient when they're in the clinic.
Sure.
Right? At the end of the day, our service does not cost the clinic anything. In fact, we make the clinic money through billing for the codes that CMS or Medicare pays for.
Could you explain that point more?
Sure. So chronic care management is a time-based codes. We spend approximately, on average, about 60 minutes of time with the patient each month. For that 60 minutes of time, the clinic receives approximately $130 some odd dollars in remuneration directly from Medicare.
Understood.
For billing for those codes. The cost for our service is approximately half of that. The balance is profit to the clinic.
Understood. So not only is it lightening the phone traffic, lightening the whatever it is, back and forth, et cetera, it's also a money-making operation potentially too.
Absolutely.
Yeah.
In fact, for every 100 patients that we care for a clinic, after all expenses and the cost of our bill, the clinic makes in excess of $6,000 per month.
Wow. So better customer service. I'm assuming less frustration from seniors or the patients with the doctors, right?
Absolutely.
Maybe more educated patient, knowing what's coming next, who's dealing with it, et cetera. I mean, these all seem like fantastic benefits. I love it.
Yeah, it's great. And perhaps the greatest benefit to the clinic is that we meet with these patients, with all of the patients, on a weekly basis, even if just for a few minutes, to help them with what they need help with right now. Through that interaction, we build relationship with the patient. And we're nothing more than a new department for the clinic.
Yeah.
So that relationship building really enhances the overall relationship with the clinic.
Certainly. I mean, I could imagine it would go from a frustration of being unable to book an appointment to I've spoken with my associate, my teammate, et cetera, on a regular basis. I mean, it seems night and day.
It's very rewarding for
Wow.
the clinic, for the patient, and as well for our health coaches as well.
I love it. Can you speak for just a high level overview of, what does the process look like in the sense of, let's take my mother as an example. Let's say she is onboarded as a new patient of yours. How does the interaction start? What happens? Is there a portal she's going to? Is it a phone call she's making? Like, what does that look like?
Great. Good question. So the enrollment starts with our contacting the customer, the enrollment starts with our contacting the patient after the clinic has introduced chronic care management through handing out a brochure or a medical assistant or even the provider communicating with the patient that this is a new part of their care plan with the clinic. We reach out to the clinic. We reach out to the patient and begin that interaction. So when the patient comes onto the program, we go through an enrollment process, which is an interactive conversation, a Q&A session with the patient to determine, number one, their chronic conditions, and then what their needs are, both condition-related needs as well as their challenges that surround their medical world. When we go through that assessment, our program develops a care management plan, which addresses everything surrounding their conditions and their medical world. And then we implement that plan. That plan consists of, again, of setting goals for dealing with their chronic conditions and enhancing their life to keep them, number one, and especially out of the hospital and in the doctor's care.
Yes, yes, certainly. And is there communication between your team and the doctor, or there's some kind of manner in which the doctor understands, hey, these are the things that are happening on this patient's account?
Absolutely. So the provider or the doctor provides general oversight of the program. So through the EHR, the doctor logs in and can take a look at the extensive care notes, chart notes, as they're referred to, as well as all interactions with the patient and the patient file.
So you're plugging into the doctor's system as well, essentially, so that the doctor's looking at everything they're doing, but also that what you're doing in one place. Is that right?
Absolutely. We interact directly with the doctor's EHR as
well.
well.
Sounds fantastic.
Yeah.
Let's talk about, if I may, like why we care. What's your why? Where did this stem from? Why?
Well, it really started when my mother, who's in her 80s now, became challenged with everything surrounding that medical world. Those challenges created frustration, a lot of frustration. And for an elderly person especially, that can be consuming, right? Their medical world really consumes a lot of their thought in life. And those challenges create stress. And stress is very unhealthy. And I was seeing that with my mom. And so I started investigating, well, what about these things? How is this being dealt with? And as a result, really saw an opportunity to assist the medical world in that process by developing a comprehensive care management company.
Fantastic. And is this a new concept generally, or this is something like, are there many other companies doing this particular niche service? Because frankly, it's the first time not that I know I'm in this world, but this is one of the first times I ever hear of such a thing.
Yeah, there are other companies like us that offer services as ours. I'd like to think we offer the most comprehensive service out there, which I think we really do. However, doctors can run this program in-house. And to give you an idea, let's back up a couple of steps. So chronic care management was really investigated by Medicare in the 2010 through 2014 area to determine whether it was a viable resource which would help, at the end of the day, as I mentioned, keep the patients out of the hospital. Hospitalization creates a very large expense to the Medicare system. And we all know how challenged the Medicare system is. And so this resulted in 2015 in physicians being able to offer the services for chronic care management to their patients and be paid for it by Medicare. Now, lost train of thought.
No problem.
Yeah. So the problem with providing the service is that the physician and the physician's office don't have the capabilities to really pull it off. It takes very extensive amount of time. As I mentioned, we spend on average 60 minutes with the patient and in the patient file per month for every patient.
You multiply that by dozens of patients, if not more, it becomes a very significant cost.
Especially when it reaches hundreds of patients.
Yes.
And we serve thousands of patients with our practice.
Yeah.
And so we take it. It takes approximately 13 full-time employees for every 1,000 patients that we have on the program.
Wow.
Yeah.
Okay. So I quickly realized that a doctor may not be equipped in order to handle this from an employee standpoint.
From an HR standpoint, definitely. From a space standpoint.
That's a good point, yeah.
From an attention standpoint.
Yeah.
And it takes away from their core focus, and that's treating the patient in the clinic, and allows them to bring on a whole new division to their company through us without cost.
I wish I could do it for my own company.
Right?
I understand. Okay, so look, born out of need, your company, We Care, and you've seen the issues, you understand them intimately in your own life with your mother, and the company has grown to, again, as you said, thousands of patients already with a full team ready to, fit in quickly with a doctor's office, right?
Absolutely.
Yes.
We generally integrate within about a 2-week period of time from go.
Got it. Understood. You had mentioned to me previously about there's some special codes that you wanted to mention about an overview for chronic care management. Could you explain it to me?
Sure. So the specific CPT codes that surround chronic care management are really 4 codes. There's a 99490, which is the first 20 minutes of regular chronic care management, and then add on additional codes, a 99439 code for additional 20-minute increments. And then when we have focused and advanced needs by the patient, and we need to spend more time with that patient, then we have extensive chronic, I can't even think of the word at the moment, but
no problem.
Yeah. So anyways, there are 4 codes that surround chronic care management, and then other services that surround that as well, such as remote patient monitoring. Remote patient monitoring is actually providing a device to the patient for their vitals.
Oh, wow.
Yeah, whether it's weight to deal with their obesity, perhaps, blood pressure to deal with their hypertension, glucose monitors to deal with their diabetes, for example, that report directly to the clinic and to the platform what these readings are on a daily basis.
And your team is monitoring these as well in between sessions with the doctor. Is that correct?
Completely.
I understand. So tremendous benefit, God forbid there's some issue. You're going to know about it much before going to the doctor, or worse, to the hospital.
We know about it immediately and alert the clinic immediately if there's an issue for extraordinary readings.
Wow. And just my gut reaction, while an hour might seem like a lot, and if you're touching base on a weekly basis, it's really not. Like it's not.
It goes by quickly.
It goes very quickly.
Especially if the patient has challenges and needs help. And our health coach is actually getting on the phone with the patient, not just giving them a phone number to call, but we actually walk them through the process.
So I mean, they may wait an hour just for some referral to pick up the phone. I mean, right?
And it does happen.
Yeah. Okay. But I assume also, correct me if I'm wrong, this is a guess, but at the scale of which you're operating, you are maybe have more direct access to some of these places than a standard patient might just generally call. Is that a fair statement?
With many doctors' offices, we do. So we have connections and we have direct phone numbers and so forth to be able to get through.
Understood.
Especially with the primary care clinic, our clients.
Look, it's been a tremendous overview of chronic care management. Again, for a layman like me to understand, benefit to the doctor, benefit to the patient. It seems like a tremendous service that should be investigated immediately.
We'd like to think so.
Yeah, by any physician's office, right, that want to utilize your service. I found it very, very interesting. So I appreciate the time you spent with me very much.
You bet. My pleasure.
Thank you.
Okay.